years to help women's sexual health, women of all ages. And the foundation's hosting a special discussion in Covington next Tuesday. And the topic affects every woman at some point. It's menopause. And joining us now are Patty Brisben and gynecologist Dr. Somi Javaid. Ladies, good to see you. Thanks for coming in to talk about this morning.
Thank you for having us.
Patty, let me talk to you first. You are bringing together a whole range of experts to talk to women about this on Tuesday.
You know what? This is for the community. This is for women to be able to come and have a safe environment and be able to listen to these fabulous doctors that we have in Cincinnati and be able to make either find out what's going on with their body or be able to find the doctor that they really want to go see.
Okay.
So, and it's great because the doctors come in and they're asked questions, and then there's an opportunity for the guest in the audience to ask questions.
Dr. Javaid, do you find that most women don't really know a lot about menopause?
Surprisingly, yes, or they don't know that their symptoms are attributable. They
Okay.
figure they're just tired, or they don't understand why they're hot flashing, and when I tell them, you can't find your car keys or you're not sleeping because of your hormones, it's the
Okay.
biggest aha moment.
What are some of the parts of our life that menopause can affect? I mean, you mentioned sleep for one thing and memory. What are some of the other things?
Overall health, definitely women feel a lot more tired. They're not sleeping, like we said, and then obviously their sexual health.
Relationship? Can it affect relationships?
Absolutely.
Yeah?
Yes.
In what way? In what ways? Yeah.
Just not wanting to have intimacy with their significant other. Mood. Yes.
Yeah, but decreased libido,
Right.
obviously that affects the relationship. And if they're tired and cranky, then they're not maintaining that level of, that relationship that they have with their partner.
Well, it seems like there's a lot of differing information out there too about whether there is a treatment or not for it, if there are ways to deal with it. Are there
There are
helpful
some
things?
very exciting treatments.
Yeah?
Yes,
Absolutely.
Like
yes.
what?
There are two drugs out there on the market. One is Addy, which was FDA approved in 2015. Brand new drug, Vyleesi, just approved June 21st.
What
We're
do
going to be
these drugs
talking
do?
about it. They work on melanocortin receptors in the brain, so basically turn up signals that say yes, turn down signals that say no. So basically, no more mercy sex is occurring in houses. Yeah, it's a game changer.
Wow.
Yes. So
Now, why haven't I heard about this before?
Because you haven't interviewed me yet.
Okay, well, that's a great answer. I love that. Or I haven't gone to one of these discussions. I mean, this is such a great thing to do.
You're absolutely right. That's why it's so important for women and men both to be at this discussion.
Yeah.
Because sometimes we want to be there to help our partners through. And we want to have a better understanding so we can. And this is a great platform. You know, you should come to the Metropolitan Club on Tuesday night at 6, because you're going to hear things that are not out there in the public right now.
I learned something here today. Thank
There
you,
you go.
Patty,
Thank
Dr.
you.
Javaid.
Thank
Tuesday,
you.
you heard at 6 o'clock, Metropolitan Club in Covington. Go to local12.com if you want more information. Have a great weekend.
Thank
you.
All right, right back in a moment.